If federal workers' comp is so fair, why does everybody have so much trouble? Federal workers' comp is not occupational medicine, although I'm a professor of occupational medicine. That's not the expertise you need. You need to be an expert in legal medicine. 50% of litigation requires a white coat, a doctor's opinion. And all we learn in medical school about legal medicine is that lawyers don't go to heaven. The biggest complaint I hear from federal workers, I can't find a doctor. Federal workers and their supervisors have no training in federal workers' compensation. This is a form in federal workers' comp. It's called a CA-16, Authorization for Examination and Treatment. It's required by law. If you have an acute injury, the supervisor has to give it to the employee. They can check a box they disagree, but everybody gets paid. Every medical provider, hospital, clinic, surgeon gets paid. Now, if, say a year later, they decide it's not work-related, everybody gets paid till that point in time. And guess what? The federal government doesn't give them out, even though it's criminal law, fine, imprisonment, or both if you don't. No one knows what to do. The doctor's got to be a lawyer first, and then a doctor, or otherwise someone's going to be hurt. Many large hospitals and clinics have tried federal workers' comp, and they've failed. Worse than they failed, they've hurt patients. For instance, a hospital tried to do federal workers' comp for 2 years. They fell on their face. I saw the types of reports they put out. I saw the type of schedule awards or impairment ratings they did. They can't do it. They now know how to follow the regulations needed in the Federal Employment Compensation Act and the Office of Workers' Compensation Procedures. You've got to be a lawyer in this stuff. This sick doctor from Oklahoma, through 50 years of training, has learned how to do this. I have all the systems. We always get paid. We always win. I've been doing seminars on federal workers' comp and VA disability since 2004 all across the United States for federal unions and for hospitals. Let's say it takes a year to get a claim finally accepted. They finally give up and obey the law that they're supposed to obey. We know how to retroactively go back in time and bill for all those services. We're going to get you taken care of. We're going to get you paid and us paid. I had a patient, paid an attorney $11,000. Nothing happened for a year and a half. Little conference session with my paralegal and myself. We have this done. We have a report. And in a month, he's getting 75% of his pay tax-free, and we're getting paid for all the services we rendered. The reason we always win, the reason we always get paid, is that the federal workers' compensation law is ridiculously fair if you know the law and all the procedures. It's supposed to be non-adversarial administrative law, but no one applies it that way. And therefore, everybody gets screwed. The VA, which is very important in federal, because about 30% of federal employees are veterans, its law is just as fair as federal, but no one knows the law. Had a general come in. I was a flight surgeon in the Army. A general come in. Doc, we're getting more complaints about you than the other doctors in this section. You're finding more disability on the exit physicals. General, did you get a call from Washington? Have you read the VA law? General, I didn't keep notes in medical school. I read the law. The law is ridiculously fair. I apply it correctly. But what's happening here is Top Sergeant is telling these kids that if you file for anything, I'm going to keep you an extra week. So I have to overcome that lie. Federal workers' comp and the VA laws are procedures and regulations. All the case law says that obviously Congress realized the individual, either federal employee or veteran, is taking on the whole federal government. Therefore, the veteran or the federal employee always wins, but no one knows the law. We apply the law fairly and correctly like it was written, and that's why we always win. We have all the systems, all the procedures, all the forms ready to go. It's ready for this sewing machine we've developed here, this widget we've developed here, to go national. Federal workers' comp and VA is all white coat, and that's the problem. White coat people are not trained in this. They don't want to be trained in it. They don't like the scut work. They don't like to do all the little nuances that have to be done. Well, that's what's needed by the patient.
I'm live. Okay. W Ellis. 5-3 from Oklahoma. We're going to talk about federal workers' comp, VA disability, Social Security, things like that, legal medicine. Their laws are very, very fair. Why all the problems? There's a bias against anybody that has an injury. Everybody thinks everybody's faking. And the biggest problem is white coats. Pretend I've got my white coat on. I am a doctor. I've been practicing medicine since '69. And we have no training in legal medicine. Now, legal medicine, every 50% of litigation requires a doctor's report, like federal workers' comp, VA disability, car wrecks, Social Security, and we have no training. Classic one is a company driver, company truck, wreck, broken neck. The neurosurgeon does a surgery on the neck, and the insurance company writes, is this work related? Because the doctor has to say it. Well, obviously it's work related. And the neurosurgeon, I love him. He's a wonderful guy. He can operate on my brain anytime. Probably needs to. But anyway, I don't know. I didn't see the truck wreck. So that happens. Now, in federal workers' comp, you have claims exempt jury with education. And sometimes I read their opinions and my God, they didn't get GED. I mean, we're talking about stupid. Then VA raters are not well educated. Some of them are good, some are not that bad. The doctors that government uses sometimes are dishonest. Okay? When I started doing legal medicine in the early 70s, there was a doctor for the insurance company who was, if for an operated back, they 0% impairment because the surgery went well, and another doctor for the industry say 50% didn't matter strain or operate. Both of them lying horse. Okay, so don't trust white coats. Pretend I got my white coat on. All I do is tell the truth. Okay, now let's answer some questions. Before we do, all you vets out there is in the works for the last year, about a year and a half, thought a process of maybe they're not going to give anything for sleep apnea. Now it's usually 30 to 50. Okay, there's in the discussion. We're going to give you treatment. We'll give you a spay for your CPAP. We're going to give you 0% impairment. We don't know that. No. So the point is, file for sleep apnea immediately, but before that occurs. It may occur in July. No. So file for sleep apnea. If your wife says you got it, file for it, and then you can always look at it. You need to get it in before they decide sleep apnea has no impairment, which is just fraud. Okay, that's the pearl. Now, first question from Mercedes. Scheduled award payment be higher when I had multiple injuries such as knee, elbow, neck in the same day at work, or do I file separate schedule for each body part? Good. Okay. Federal workers' comp. The whole arm, you rate the whole leg. So you're born with a club foot, and then you play basketball, and you have a basketball surgery in your knee, and you have a car wreck, you have another surgery in your knee, and then you're a Marine, and you have another surgery in your knee. You work for the government, you got a strain of the knee, and then you have another injury from something else, and a nerve down your leg. You rate the whole leg, the nerve down the leg, the totally as it is. Now, no one knows that, so if you get a scheduled award, you need to have a toll. Not even me. Okay, so that's a scheduled award. No, it doesn't matter what it is. We rate. You know, if you've got a strain and your knee covered, we rate the entire leg. That's fair, folks. All right, Lamar, how do you rate chronic asthma due to Afghanistan? Your spirometer, your breathing test will tell you. But also, a lot of times when you're in between asthma attacks, your spirometer is normal, so it's more based on your symptoms. And the best way to do that is bring your spouse. I tell her the different percentage it can be, and whatever she says is probably going to be my scientific answer. Okay. it's asthma. Now, lung disease is just on the spirometer. It just speaks for itself. Okay. And the VA, you don't have to get that. The VA will do that. Just bring me a copy of it, and we'll do the nexus causation report. And it, well, I have a vape hospital in St. Louis. This is VA, by the way. Oh, Dr. Ellis, you're so wonderful. You give us the history and the physical. You look up the code, you give us the percentages, and we like your nexus reports. That makes sense. Okay. We show other people like you guys, lady, don't say that loud. You'll get fired. Okay, so that's how you do it. Here's Evan. Can I file something like claim for my ankles primary to service and then bilateral arthritis for knees, second to the ankles same time? Also, okay, sure. Okay, so you have flat feet before you go into service, still hire you, and they get worse, and you have a limp. That means your whole both legs back covered. It's aggravated. It's aggravated. It's covered the same way. State work, probably not. Depends on your state. Okay, you got to have a higher barrier. But in federal and VA, very small. Okay, so that was arthritis in the knees. Now, migraines, secondary tendons. Oh, there are medical studies and case law. Case law, you can go VA, Board of Appeals, Google any case law linking tinnitus, ringing ears, and migraine. Then cite that law. Give it to your doctor. Have him cite it. Okay. Major depressive disorder caused by tinnitus. Oh, yeah. Okay. And chronic pain from the ankles, knees. That's another. Yeah. If you're having chronic pain and you don't get sleep pattern, you don't get rapid eye movement sleep, that's like being in a concentration camp, waking up every 30 minutes. It's going to cause a change in the chemicals in your brain. It has nothing to do with your mood. If you're going to get having sleep, you're going to get depressed. Sure, that's all covered. I believe I need to get the MH claim. Wonder what MH is. What's that stand for? Do you guys know? Mental health claim. Okay, thank you. Ankles rated before I file for sleep apnea. Do it at the same time. Do it the same. And weight now, of course, the weight gain from your knees and ankles. So that's going to win it on itself. Okay. Mental health. Add more to the fire. Because the law is very fair. Jerry from Virginia and oh, this is from Georgia. Okay. Mary. Okay. My question: can my VA disability go from 90% to 100% due to my diabetes got worse, affecting my ability to walk from the VA? Sure. Things get worse, and you get a peripheral neuropathy. You can't walk, and you get more weight gain. You need more insulin. Sure. It can go higher. You may add other things. All righty. Jacqueline. FECA, that's the Federal Employment Compensation Act. That's Federal Workers' Comp. It was accepted. Exacerbation of osteoarthritis. I was put on the roster for monthly payments with no options for work at my place of employment. He's a paramedic. Well, obviously, we do a lot of that stuff. The first routine, she puts it in quotes, second opinion visit to their doc, had them add my feet and ankles to already accept hands and wrists. You check the MMI box. No one explained what it meant for years. The most recent second opinion, 2 years ago, checked MMI is not met. If I apply for a schedule award, does the most recent exam negate the MMI? Let me explain MMI. Maximum medical improvement. It's different for doctors who are not trained in FECA law. For instance, a doctor did 5 surgeries on a man's knee, did it under federal workers' comp, so he didn't have to do it in health insurance, didn't have to pay copay. Thank you, doctor, for even seeing somebody. But you got the question, when am I going to be at maximum medical improvement? When can I get a schedule award, which is an impairment rating? Money for, like a car wreck, you get money for a strained neck or whatever. Well, never. You're always going to need a brace. You're always going to need physical therapy. That would have cost him over $300,000. Doctor, don't answer questions about FECA unless you memorize the law. And you have not.
Lawyers don't know this stuff. Okay. No, you're at maximum medical improvement under the Federal Employment Compensation Act, Office of Workers' Compensation Programs. In other words, you need to continue maintenance therapy, you need injections, you need therapy, but it's not going to make a difference. Since it's not going to make a difference, you can do a scheduled award. Now, if you're scheduled for next month, you're not at medical improvement. So you're at maximum medical improvement. Maintenance therapy, and you need therapy. If you say, doctor, I don't think that's going to make it. If we don't do it, it'll get worse. Then you can get your scheduled award. So you've lost a lot of money over the years. Okay, don't trust people, including me. All right. So that's all our questions. You got any questions?
We do have some questions here. First is from YouTube, a Leander Savoki, I believe. Went for CMP for increase on my 40% loss of use of foot examiner. Said she was changing it to loss of use of knee, had for 38 years, severe knee arthritis and bone on bone. What will happen now?
I assume this is VA, you think?
It says CMP. So.
Yeah, that's CMP. So yeah, I assume that's VA. Wait, you get a knee in your foot. Hopefully. And if not, you go get someone to write a nexus or causation report to rate that knee. And it helps if the doctor will pull up the codes, because there are a lot of codes. For instance, the VA law, if you have a strained ligament, then you can rate it at slightly strained, moderately strained, severely strained, 10, 20, 30. Plus you've got the arthritis, bone on bone. That's arthritis, and that's the other end of the rating. And so you put, because if you got bone on bone, then you're like a flamingo. You're loose. Okay. So the ligaments are loose, and it's just a matter of how loose they are. The doctor rates that. There may be 2 or 3 ligaments are loose, rates the arthritis, and then rates the range of motion, puts it all together in a pot, and that's your rating. And it's all in the book. It's a big old book, and you just look it up, and it's all in 10% increments, and it's not rocket science. And it's been around forever. Paralysis agitans is the name for Parkinsonism. I graduated medical school in 1968. We were not using that term at that time. So it's been around for a long time. Very fair, but no one knows it. Okay.
We have Ramsey from YouTube. I have 2 cases, left elbow, the first case, and the second case is left shoulder. And Nick, the first case, I own money for the OWCP, $10,000 for surplus. Do I get disability for that?
Yeah, you do a rating. I mean, we always do a scheduled award, and let's say you've got a scheduled award at 10%, it goes up to 15, you get another 5%. If it goes down, don't file it. You don't pay it back. So do another scheduled award, and then and take the money that they pay you and pay off what they overpaid.
And add on to his comment, and I still don't get paid for last October because the bill reviewed the doctor report about my disability.
That sounds like time off work, temporary total disability. Yeah, you're going to need a medical opinion saying that you were off work at that time. If you have any documentation that you're off work, then you try to get that temporary total disability money.
Right. Moving on to TC on YouTube. I'm an air traffic controller and lost my medical, and I am OWCP pay. However, OWCP now forcing me to vocational rehab and wants me to find a 15 an hour job, and they will make up the rest in pay.
Be sure you show up. Yeah. Be sure you show up. You've got to do that. Now, it's a shame that you can't take that great talent you've developed over the years and use it. Okay. But you've got to show up, and they will do that. So let's say you're working 4 hours a day, and then you can't work 4 hours a day. So you get salary for the 4 hours and workers' comp for the other 4 hours. If you're getting paid less, you get that differential under workers' comp. But you watch it. Don't trust their math. Check it each month.
There's an add-on to TC's comment, that you answered most of, but if there's part of it you didn't, feel free to answer. What are my options? Claims examiner valid, their second opinion doctor, and now my case is in district medical advice or repeal. What can I expect, and what kind of advice would you give me?
You could expect to get screwed. Okay. I'm sorry, but that's just, you can just expect that. If you don't get great.
Okay, because the bias against the injured litigant, the district medical advisors. Now, some of them are honest, but a lot of them think it's their job to cut things down and to stop stuff, and because they think they will not get referrals if they don't do that, which is probably true. It's just like if I'm working for a respondent attorney, say in car wrecks, I've got to guard against wanting to write a zero so he sends me more business. If I'm doing a legal medicine report for a ambulance chasing attorney, a plaintiff attorney, I've got to guard against writing a high number so they send me more business. And a lot of people don't guard against that. A lot of people let the money go. Like I said, 50 years ago, one guy writes 0% for an operated back, another writes 50. Neither one of them touched the patient. It's just awful. And so do not be surprised if white coats are whores, dueling doctors.
So we have a shout out from Bill and Casey Heldon, greetings, Doc, from 1st Aviation Brigade, 11th Battalion, AHC Vultures.
Yay!
Now we have an add-on comment from TC. The claim examiner value their second opinion, Dr. Moore.
Oh, of course they do. That's why they use them. Also, you get a second opinion. Now, if anybody in the federal government agency, supervisor, listen to me, I will save you zillions of dollars. So they've got to get this thing. So they'll just send it another second opinion, another second opinion, another second opinion, and just run up a bill that you're paying a bunch of second opinions when because then they don't have to make a decision that day. They just get it off their desk and go home. And it's just awful. And you have no control over. You're not even going to know their last name. You don't know what they look like. You don't know what their training is. All the training they need to be a claim examiner is a 12th grade education. My God. And they have no medical training. And they have the bias because everybody does. Heck, when I started doing this in the early 70s, I thought 60% of my patients be honest. And 40% be kind of a little flaky, a little dishonest, try to get some more money than they deserve. That makes me amongst normal doctors, not insurance company doctors, normal doctors, very pro-injured person. Now that I see it all the time, the people that are faking are very rare. And even fakers are real. This is a state workers' comp case. The guy is a principal and a counselor in a small town in southwestern Oklahoma. And he has a bad foot. And he gets 40% impairment for this mangled foot and 10 or 20% for the back from the limp. Well, I see him about 20 years later, and the foot's much worse. It's called a Charcot joint. I mean, it's bad. This guy, and of course, his back is much worse. Okay. And I can't get him to stand up and bend over. I can't get him to even do range of motion like this in a chair. Okay. And you know he's a liar because he writes non-smoker and his fingers are just as brown as they can be. But I don't care if you're a liar or not. If you're hurt, I'm going to write the report. Okay. Anyway. So I said, sir, we cannot say you have no range of motion of your back and of your neck because that's not true. I saw you walk in here. No, I can't do it. I said, no, you're going to go to jail. That's a lie. Let's measure it as it really is. It's worse. Let's measure it. Wouldn't do it. So the video is as he's in a racquetball court practicing by himself through the plexiglass. He's got his racket, and he takes that racquetball and hits it. It hits the cove. It hits and dribbles back. So if you're playing with him, you're not going to hit it back. The guy's an expert in racquetball. His back actually is worse. He can't bend down and pick that ball up. But he can take his racket and hit that ball until it starts bouncing up, and then he picks it up. So his back has gone to 40 or 50%. Neck is not obviously injured at all. So I had to go testify against him, and the insurance company doctor testified against him, and he wouldn't cop a plea. So we go back a second time, and he wouldn't cop a plea. He goes to jail. Now I think that he is disabled because before I said you could always be a counselor. They need counselors in southwestern Oklahoma. Now I realize he's too stupid to be a counselor, so I think he really is permanently disabled. But it's too late, he's in jail. Okay, but just tell the truth. Another case was, this is another state workers' comp, raided the back, and the Ardmore newspaper, he's holding the saddle. He's steer roper. He's holding the saddle. and Gary Faribault, who's a respondent attorney, great guy. Anyway, could that change your opinion? Sure. Okay. So John Sprouse sends him back up, and his back really is worse. Now, what happens is they're steer roping. He's on the he puts the rope on the back and hind legs of the steer. They show me a video, and this guy's doing it this way. He is not moving his back. And so based on the video, I raised him to 40%. But normal person would have seen that saddle and said, that's it, he's a liar. No, you've got to know and do an exam. And people that make opinions across desks without a white coat on, I don't give a shit what they think. For instance, I got a call from a plaintiff attorney, does car wrecks. And the secretary called, said, just give us a report. She's got her arm in a sling. I called the attorney up and said, this is the worst third-degree separation I've seen in 3 years. Fire your secretary. Because you cannot train bigotry. You know, if you think everybody's faking, you're never going to change your opinion.
All right. So we have here one from David Parker Thomas on Facebook. What is better, to be on periodic roll or schedule award? I'm 69 years old. He continues to say, can you get a schedule award paid out all at one time, or is it always paid out in weeks?
It's always paid out in weeks, but you can get it in a lump sum. So at that age, you know, how long you think you're going to live? Maybe you got a kid that's got to put through school or something. You can get a lump sum payment. You pay a 4% penalty. But that lump sum may be something to pay off your house or something. That may be a good thing. But because schedule award, when you're on the periodic for everybody, that's a temporary total disability. You're getting workers' comp because you can't work. It's the same amount each month. You can't tell it's from temporary total disability or paying off a scheduled award. The way you know a scheduled award, it stops and then payments stop. Okay, so getting a lump sum may be a thing to think about.
All right. So we have more praise again back from TC. Love your honesty, Dr. Ellis, and for everything you do. You are awesome.
No, my Alzheimer's so bad. I got to tell the truth or I'll forget what I said. I got Alzheimer's at age 16, by the way.
All right. We have Facebook from Marcus Conley. Hi, Dr. Ellis. I've been out of work for over a year due to laminectomy and forminotomy. Then 3 months later, I had a ACDF. However, my claim is not accepted yet. I'm set up to see a referee doctor at the end of the month, not looking for a good outcome with the referee doctor. But my treating physician has written notes saying unable to work at all. Could I just ask him to refer all time off to your office? Could you guys assist in this? I'm a patient of you guys.
Okay, no, what you do, you just have your doctor write on a piece of paper or letter or just a prescription note, refer to Dr. Ellis Clinic for a consultation, and we'll do a consultation, take a look at all the stuff, and decide what to do. Now, let me show you something. Legal medicine needs a picnic table and a duck. You cannot make any decisions unless you have the entire chart in front of you. And then, so you have to have a big picnic table to look at it. So the way I would answer any question, I need to see it all, and then I'll look at it. Now, the other thing's the duck. In legal medicine, what's the duck? Okay, it's not whether your feelings hurt, but now it may be getting paid, maybe keeping a job, staying out of jail, whatever. What's the duck? And you focus on the duck and how to get to it. So it needs a legal medicine picnic table, legal medicine duck. What's the duck? Let's go after it.
All right. We have another question from Facebook by Michael Benbow. How about Social Security claims? What is needed by Dr. Ellis and the team? Will Social Security Administration accept Dr. Ellis documentation? Thanks for all that you do. Keep up the great work.
Yeah, I used to do Social Security exams, but it's not, they don't pay enough. Social Security likes the records to speak for themselves. Okay, so they don't like hired guns, and that's a good thing. Now, I will do a Social Security exam if you need it, and we'll put in all the magic words needed for Social Security, put in the actual codes that Social Security uses, so it makes it easier. So because sometimes your medical records are not going to say unable to engage in sustained gainful employment. Your record's not going to say that. So if you get your doctor to say that, and it's in the records, but it's not, they're just records, and then some layperson is going to have to determine. So, and about 90% of Social Security is turned down the first time. You get an attorney, you get an oral hearing, you talk to a human being, and talk to them, and then do it. That's just what you do. And anybody, and if you win, you pay your attorney. If you don't, usually you don't have to pay. So just expect to be turned down because your doctor's records are not going to say what's needed by Social Security.
Right. We have Tony Ann on Facebook. Can you take a lump sum payment if you're not working?
Sure. Now you get a lump sum for scheduled award, but you don't get a lump sum for being off work.
So
you just get so much for being off work. You're on the periodic roll.
So one thing, while we wait for more questions to come in that I think is valuable, and I'm going to put it on the screen, is the extent that the bureaucrats will go to file claims. And if you remember the excerpt from your deposition that I'm going to be putting up on screen, if you could refer how that reflects the nefarious nature of the government body.
No, it's people. People are assholes. Picking the number one asshole, I know that. And so people, it's just ridiculous what they do. Just absurd. Now, you wouldn't be surprised if it's China or Russia, but when it happens in America, because you're raised on the Bible and Superman comic books, truth, justice, American way, and when the GOV does that to you, it's personal. It hurts. If you're a vet or federal employee, put your life on the line and they screw you. And if you look at the map at Ellis Clinic, all those pins, every one of them's got a horror story. I mean, a horror story. And so people do not understand why I get so pissed off. It's just like if it was World War II and you've not seen the ovens in Auschwitz, then you don't get to talk to me. You've not seen the ovens that these people have been put into, the crap they've been put into.
So I put up on the screen here the excerpt from your.
Oh yeah, okay. So here's that's just a classic. Nice lady, internal medicine doctor at the VA. She's getting paid less than the men. Hey, it's woke PC time. Okay. She's a whistleblower. She likes to get equal pay. They won't do it. Her husband really high up in the VA. We're not going to sit down to arbitration. It's equal pay. So her supervisor says, let's be friends. And shakes her hand and squeezes it. And it's swollen in their emergency room, objectively swelling. You can see it. And for 3 days here, which means an acute injury, it's an assault and battery case. She also has carpal tunnel because she answers all the vet's emails. So because she's a whistleblower, and C-SPAN's done an expose how bad the VA is to whistleblowers, okay? They change her hours from noon to 8 o'clock at night so she can't go home and fix dinner for her kids. That's just chicken shit, okay? That's just chicken shit wrong, okay? So I said, come here, I'll show you how to do a VA disability, and I'll teach you how to do federal work. So then Tom Majors, and I'll use his name because this is a public record, who's the prosecuting attorney for the Department of Justice of the 4th State District, gets a hair up his ass that somehow she's breaking the law working for Ellis Clinic. A law that he's not read. But he's got a badge, so he thinks he knows everything. And he files criminal charges and blah, blah, blah. And she gets an attorney. They're going to meet down there at the federal building. Attorneys, if they've not filed actual charges, make them come to your lion's den, not to somebody else's. Law has two components, folks, that you don't learn in medical school and law school. It's prefrontal cortex, knowledge of the law, and show business or psychology. Well, I didn't keep those in medical school, so I'm going to beat you. I know more law than anybody I talk to. God damn it. Read my damn transcripts, Department of Justice. If you'll read them, you will never let me in a courtroom. Every time I've gone to federal criminal court, the judge has threatened the prosecuting attorney with contempt or jail. Read my transcripts. Okay, anyway, so he does the show bits. Waits, everybody seated, comes in. I've been on your YouTube, and you don't like U.S. attorneys. I own him. Listen to me. And so what do you do for that? Where do you go to school to learn how to handle that? What book do you read? So I'm sitting there now. Don't smirk, because this guy's a fool. He's gotten away with that because he's got a badge, which means he's the lowest on the totem pole. You have to behave. I don't. If I'm a cop, I'm paying for my body cam to cover my ass. Okay. But everybody's afraid of him except me. Because in America, the law is the law, and I just demand you follow the law that is written. That's fair. And if you don't, kiss my ass. Okay. So anyway, so I sat there and I did nothing. Just sat there and sat there. He's used to the limbic system, the emotional brain, getting in and yelling at each other like in preschool. I said, sir, I've been practicing medicine for over 50 years. I don't put up with stupidity anymore. I'm going to cancel this deposition. I'm going to be a judge, and I'm going to get a ruling on whether you sit down, change the tone of your voice, and be polite. He's never been talked back to, so finally says, and then he says, you said in your website that you kick ass. And I said, yes, I do. If the prosecuting attorney doesn't know the law and I have to kick their ass, teach it to them. Sure, I do that. That hurt your feelings? Know the law. Sir, I teach this to law schools. I am probably the world's leading expert on FICA and OWCP. You just think I'm some hick doctor from Oklahoma. No, I know this shit. I've been doing seminars since forever. So anyway, well, it's 146 pages. You can read it if you want to. And so then he's lost, and so there's a little form, and his problem is that I've given her a job that somehow that's wrong. I said, wait a minute. You cite a reference when the VA says they don't have any work for her. She can't work at 7-Eleven or at Ellis Clinic. Now, if I keep her off work, because I'm a treating doctor for a carpal tunnel, which is approved, she's had surgery, she's off work because of the carpal tunnel. Okay? I'm a treating doctor. And by law, under federal workers' comp, not state workers' comp, my report has more probative legal value. It's not a fair game if you follow the law. But usually the claims examiners, district medical advisors don't know the law and just want to run it off. The once we get to an oral hearing or DCAB, the law applies. We have intelligent people, no politics. It's wonderful, wonderful, wonderful system. Okay, so now I have an ethical issue. If I keep her off work so she can work in Ellis Clinic, it's unethical. But let me tell you something, buddy, it ain't illegal. Now, in federal workers' comp, the employer can't talk to me because the law clearly says the individual's taken on the federal government. It always goes to the individual, same way the VA. It always goes to the vet. They don't apply it that way, but that's the law. That's all I request. Okay? And that's the end of it. So then anyway, we get this little form. And I said, now, before we start this little form CA-17, let me explain to you. You probably understand HIPAA and Privacy Act. And that's a civil fine. This is a 1974 Privacy Act felony when you ask for the diagnosis. You're not allowed to have the diagnosis or anything else. Now, if you've been doing it for years, I like to give you the diagnosis, which I can in state workers' comp. I can call Acme Brick up, talk to supervisor, and get everybody copacetic and get people back to work. But in federal, they can't do it. And I'll have letters to the Department of Air Force with all kinds of crap on it. We need this and this and this and this and this. Well, first of all, in the 13th Amendment slavery stop, where's the damn check? And second of all, cite a reference that you can have that. If you want that shit, you've got to go to the claims examiner HR department of the United States Air Force. General, I can put you in trouble if you keep messing with me. Read the law before you mess with this little boy. Okay, so anyway, that was into that shit. I thought, no, two guys come up. The VA has their own office as general. Two guys come up from Dallas with their badges into my office in the United States of America to see this doctor working for me. Without a warrant! Without a warrant. The balls, the audacity, the absolute criminal stupid. That's called racketeering RICO Act. So anyway, I bring her in. I said, Dr. Beckham, these guys are from Nigeria. These are fake badges. You don't talk to them, but I'll be glad to. So they sit down. Can I record? Sure, like to teach. Let the record show I'm not under oath. I can reserve the right to read and change all my opinions. But I love to teach. First of all, I have a question to ask you. Have you read the FECA Act in the Federal Register? That's the Federal Workers' Comp Law. I've perused it. You've perused a law. You're inspecting. You're coming up here to investigate to whether this lady has broken it. You perused it, and you have the balls to come into my office. You dumb son of a bitch. Are you as stupid as you look? Do you find your badge on the floor? Are you familiar with Bivens? No. In 1971, the United States Supreme Court, you may not know who that is. 5 officers denied the constitutional rights of a federal employee. He sued those 5 guys. They had to go to court. They had to pay their own attorney fees, and they had to pay their own, and then the government couldn't protect them and couldn't refund them. If you've got a badge, be careful. First of all, you get a Bivens active. Second of all, I'm going to put you in my seminars. Third of all, you're going to reference when you talk to this asshole. You don't get away with that. That's what I demand. And it pisses people off. I'm sure it does. But I'm the one that's pissed off, and I'm correct and righteously pissed off. So don't mess with my babies. Okay.
We illustrated the links you'll go to extend your patience, which I think anyone here can appreciate. But let's move on to some final questions here before we cut out for today. So we have one from Yolanda on Facebook. I requested a review of written record for my CA2 claim, and 2 issues noted were that the reports from your clinic lacked physical examination findings, and I was not approved for your clinic. There were 2 other issues that are easy to fix. My visit was supposed to be a telemedicine. Do I need to come into the clinic? Can my claim be solely denied based on lack of physical findings and lack of approval?
I'd have to actually see the report and see if there were a lack of physical findings. That's a common cut and paste. No objective this, no this, that. Yeah, did we examine you? Did you have high weight and blood pressure? Yeah. What's this lay person expecting? Yeah. We'd have to so that we need to see the report, see the chart, put it on the table, and look at it. And if we didn't have physical findings, or if it was done telemedicine, then you have to come in and have a physical exam. Right. But we'll look at it on the picnic table and make sure it's okay. But do not be surprised when because you can see it's a template. No objective findings. Well, everybody with a headache is a liar because there's no objective findings with a headache. There are very few objective findings with the back. Maybe a reflex change, but there's and a muscle spasm, but there's no objective findings. Now, maybe an MRI, but that doesn't mean it's causing the back problem.
All right. TC again, how long can I expect to be on wage loss from OWCP? Are they going to keep going to hassle me, or are they going to keep hassling me?
Oh, they're going to keep hassling you, and they should. They shouldn't let people just stay on workers' comp. You're going to have periodic reports. Every once in a while, they're going to want a second opinion. I think that's reasonable. They're paying, But now, here's a 60-year-old postal worker. Hips, knees, and ankles are approved, and he's on a walker. Well, he obviously can't be a mail carrier. Okay? And he can't do a lot of things. He really can't even sit down. The nurse case manager wants him off workers' comp, temporary total disability, at 75% of his pay tax-free, and on FERS retirement, 40% taxable. So that's a good idea. That'll save post office a lot of money. You hired him under 1916 law. Why would he change? Why would he elect the stupid part? Well, they don't like it. Well, they're not the law. I'm sorry. That's the law. I think it's a dumb law. I think it's too fair, but that's the law we apply. I mean, I would raise it up to more than it. If it contributes the slightest amount, it's covered. I mean, that's too fair, but that's okay. That's the law. That's what I expect to do. That's what I do. Okay. So they send him to 3 second opinions. You said he can work. Yes, he can work. I've told you he can work with these restrictions. Obviously, he can't stand up and walk and climb stairs. And post office says, we don't have a job like that. So he stays on workers' comp. And so the post office pays his workers' comp. And he paid these 3 different second opinion people
I don't know how many thousands of dollars, but a lot more than I get paid. And you, by the way, you go in your econ account and see what they get paid. It'll really piss you off.
So we have a Facebook comment from someone I think you'll know, Sherry Campbell, who says, you get a lump sum if you can prove that you have other monthly income. You must submit in writing to your econ that you want a lump sum of your scheduled work. However, please remember a lump sum prevents you from getting another scheduled work for 3 years.
Mm-hmm. Oh, good. That 3 years. That's a good point. Thanks, Sherry. Sherry, I work for her. She's our office administrator. I just work here.
All right. We have another from TC. My first disability was approved, but OWCP paid more. How long can I stay on wage loss before I have to switch to first disability?
You can switch back and forth. You want to get a FERS to always fall back on, but you want to be in workers' comp disability. Now, I had one person, I want to be off workers' comp disability, temporary total disability at 75%, and I'll be on FERS at 40%, because I'll add 10 years of my life not worried about being videoed and surveillance and harassed and having second opinions. It's worth it to me. It makes sense to me. Always want to do, if you always want to have a FERS in your bank deposit, so you can fall back on it if you need it. If they ever say you're no longer an employee, if you're on workers' comp, you're still an employee. But if they ever say you're not an employee, you have 1 year, 365 days, not 366 days, to file for FERS. So do it, get it.
All right. So Andrew Culliff on YouTube has a comment. Doc, you did it for me. 90 to 100% VA with one Nexus report. Thanks for your help.
Well, no, you had a good rater. You ended up with a good rater. Yeah, they're not all bad people.
All right. Well, is there any other comments you'd like to make before we end this month's?
I just thank you for being able to do this. This is just more fun. This is my hobby. God, I love doing this. And God, I love kicking ass.
All right.
I've got one for you. One of our visitors recently on YouTube asked a question. I just wanted to get your reaction to it. I think it was either Mercedes or Jacqueline, but they wanted to know if he had run for Speaker of the House.
No, I could never be a politician because I'm not going to remember names. Dr. Ellis, you led my husband, the Lord, 4 years ago, and he talked about you all the time. He died last year. I don't remember. I thought, well, maybe I have Asperger's. That's why I don't remember names. Then I thought, no, I just don't give a damn. No, I will put my life on the line. I'll charge the windmill for you. I'll charge the machine gun for you. Don't ask me to remember your name. Okay? I'm your cheerleader. I'm your warrior. And I love war. And I love telling the emperor when to have clothes on. My wife says, you're getting paid to be an asshole. So I'm getting paid to teach it.
I think this is a relative comment that Doc Ellis should run for president.
Never. No. Let me explain. Okay. So Oklahoma put in a certified workplace medical plan, which is HMO, ERISA protection, and workers' comp, which ought to be the kiss of death for the poor working guy. And the State Medical Association had an HMO. They asked me to be the head of the workers' comp division. So I called all these insurance companies together. Let's start a certified workplace medical plan association. Now, that's like Dracula calling the blood banks together. Now, I cost all those insurance companies more that you get 10 doctors, and I cost them more money because I'm always 98% of the stuff I do is on plaintiff side, unless it's really esoteric, environmental, and then I do big buck stuff. Okay, most of my stuff is from plaintiff attorneys. Okay, so it's like Dracula calling the blood banks. Okay, and so now everybody's going to show up, but no one's going to share your proprietary information. And I'm sitting there and I look out at the crowd and I said, guys, I apologize. We're the first state to try this. Okay, there are 49 states watching this experiment. And this is like signing the Declaration of Independence, the Constitution. This is an historic day. I should have brought a photographer, a painter. They made me the first president. Now, I did a lot of behind the scenes stuff, good stuff, behind the scenes stuff that no one will ever know about until they get to heaven. And I went, ooh, this sense of power. Wow, that's worse than drugs and sex. This is scary. And I wouldn't be the president next year. Oh, no. This is, ooh, I've got enough ego. I don't need this shit. But now here's what's interesting. So you've got HMOs, ERISA protection, and
state workers' comp. That ought to be the kiss of death for state workers' comp patients. But they passed a law. If there is a complaint, say I want to change doctors, I want an MRI, I want surgery, it has to be settled within 10 days. You can't get records in 10 days. So the answers are always yes. Just to, because it protects you to stay under the risk deal. And so I was talking to Liberty Mutual. I think they had 100,000 people signed up. The guy remembered the one person by name that went to an attorney. Usually, when I saw state workers' comp, if they just treated me, but the insurance company just debauches and fights everything, and then they go get an attorney, and then it just goes. And then, of course, the lawyers make a lot of money, and the insurance company loses money, and the employers lose money, and it's just like my Bible software company. My technical support guy hurts his back, positive MRI, and my chief financial officer and vice president said, "What do we do?" I said, "Well, we're going to give him a Band-Aid and take care of him. That's what we're going to do. And I'm firing you two. You've had lunch with me I don't know how many times. If you don't know how to do state workers' comp, you're too stupid to live. You don't fight it. You embrace it and take care of him." And then when I let him go, that's one of the main reasons. Because you can't fix stupid. You still have the bias, and you've been here this long. Jeez. Okay.
Well, other than that, I'd just like to end on one final comment. If our viewers here would keep Doc Ellis's lovely wife in their prayers.
Yes.
Make sure that she gets back home quickly, because I know that she's the balance in your life, and I can't imagine what you at home alone is going to do.
So, no, my wife, Sue, my wonderful wife, I do ask for the prayers. She's put up with me for 60 years. And this sweet lady is in the hospital, heart failure and some other things. And we want prayers. Okay, I remember at age 70, had a heart attack. So I go to the heart hospital. I said, "I'm 70 years old and I'm left heart pain, diaphoretic, on aspirin, nitroglycerin, and an arteriogram. If it's left anterior, you can do anything. If it's the others, you can send it. If I wake up on a respirator, I'm suing you for assault and battery." And what was interesting, though, is my coronary arteries were almost normal at age 70, except I had 2 little clots. Okay. And, of course, been fine since then. But I remember thinking, "Oh, I don't want to tell anybody about this because it'd be bad for business." I go, "I'm a Christian. I want all the prayers I can get." So if I'm ever out in the yard, Elaine, who's my postmistress, "Hey, Doc, how's your heart doing?" So pray for Sue. Thank you very much.
All right, and with that, we